Public participation has been a box-ticking exercise whereby communities are invited to give feedback to the county governments, their names are recorded, but unfortunately the feedback doesn't inform the budget documents very well.
Previously, before we engaged with the community of practice and before the training that we got with IPF and the partnership, we had some level of awareness, I could say, but the capacities of the community groups that we were working with was not as effective in engaging in budget advocacy for allocation of resources at the county level.
We didn't really understand how to execute budget advocacy, because initially with the previous government that got out of office in 2022, we were having a very difficult time to engage the duty bearers. Anytime we could rise up and raise issues around budget advocacy in different crucial sectors like health, we will be met with not goodwill from the government. They would say that we just want to protest. They would say that we are active. They could call us activists, and they wouldn't listen to us.
So what we used to do at that time was to task the ward administrators to invite members of the public. We came up with the categories: farmers, teachers, business people. So they will come to a central area so that we engage them. And because they were coming from far, we used to give them some token, some transport reimbursement. That also encouraged them to come. Then there were issues of the civil society were now saying that, oh, if you give people transport reimbursement, you are compromising them. But the rationale was that we needed a way to engage the public before any major decisions are made.
There is even one time that some of the senior government officials made remarks that if we do not like the way the markets are not clean or the way work is being done, we should take up brooms and clean the markets, or we should take cows and dig the roads. So with that just shows you how tough it was for us.
Because of high demand for public participation, and also Kakamega has been getting high allocation in terms of budget, so we wanted to know to track the resources and how much is going to do service delivery. So we had some challenges, of course, to initiate it. We had to do awareness on the community that they are taxpayers and they need to know where the money is going, and also as tracking every budget to know which documents are in place during public participation and get quiet service delivery.
We started by going through a 6-month course on mobilizing support by KCDF. After that is when we were introduced to IPF, Institute of Public Finance. And when they came in, it was a game changer.
I had zero experience. I had no interest. I didn't know that I was supposed even to know about budgets. I used to think it was supposed to be for specific people. But after I joined the communities of practice, and then we were introduced to IPF, we began learning the budget process and everything. Now I can say I'm a budget champion in process, but I'm an advocate.
It was a game changer because they would train us on how to draft memos, on how to analyze budgets. Initially, we didn't know how to analyze budgets. We could just pick areas and talk about it and go to media and report about it. But after our engagement with the IPF, we started understanding deeper on how to analyze budgets. We have 2 cohorts that we have trained on budget advocacy, the budget making cycle. They have understood the budget making cycle. We have even gone down to having representatives who are budget champions down to the grassroots, the wards.
The citizen participation, as we are talking now, it's an area that is growing in terms of citizen awareness and how the public is getting informed. And This is supported by the work that the civil society is playing, and also the county government as a whole. But more so, I'll wish to appreciate the civil society, because they have created a lot of civic education, a lot of awareness to citizens, and they have really come out in a positive way to embrace the process of public participation.
At that time, our primary objective was to have the community mobilized to attend public participation. Then after the training, there's been a lot of change. Other than just mobilizing to attend public participation through the budget process, there's more knowledge around the budgeting processes, the planning processes, there's more engagement. The quality of products within the process, the petitions, the memos, the letters of request have gone way up. And the county is now relying on us as very strong partners in the engagement of accountability in use of public resources. So I can say our partnership has given us a lot and has strengthened the capacities, not just of members of the COP, but the citizenry that are engaged in the process.
In our sub-county Bunyala, we are there is that outcry of flooding. Now at the community, after those trainings, I did an advocacy, which we requested the government, the county government and the national government to purchase a dredger for our community, because that dredger will help for the river trainings and the drainages during flood. So we are so much happy that through our advocacy and our request to the government, the national government purchased a dredger for our community, and it was through our initiative. That dredger, as we speak, is currently there to Bunyala sub-county, and we also advocated for the county government if they can also add another dredger, because in Bunyala we need something like 2 dredgers so that can help to control the flooding in our sub-county there.
Ironji Primary School is a public primary school in Kakamega, Kakamega County. The reason why we did the social accountability in this school, it's because the community members identify a need whereby their kids, especially their young ones, did not have a conducive environment for learning. When you look at the toilets which the school had been allocated an amount of 4 million shillings to ensure that the ECD classes have been built. But when you could go to the school, you found that the classrooms, the grass is growing on the classroom, and also the toilets have, as much as they say they have been built, they had cracks, and there is when you look at the school, it seems to be like it's not functioning in the area. So when they came to the Kakamega Community of Practice, they said their issues, and we decided to advocate for the school to be built. And in partnership with the IPF, we began the activity last year in November, early November, whereby we did follow-ups with relevant country officials, and they did a follow-up with the school. We came to realize the contractor was not paid off the full amount. Those are issues with matters on contractors, but after the follow-up, the contractor was changed, and the work began immediately. Meaning by December, they had started building. Even they had, if you look, there was sand. There was a sign that construction is now ongoing, and also with the relevant stakeholders, there was a certificate given to show that there is continuation of work doing in that area, showing that this is a success that came because of the accountability process we did in partnership with IPF.
As we speak, I think we're engaging in about 6 policies in Kisumu County as the community of practice. So it has also become an area where now we don't stop at ensuring there's a budget allocation, but ensuring that there's sustainability in the long run. So that sustainability is in terms of now the policy that is being passed in the county. So as we speak, there are a number of legislations that as community of practice that we've also been able to work in. One of them is the ECD policy. So we have one anchor organization that is working on it, but for us now as civil society or community of practice, we support that organization to ensure that that policy sees the light of the day.
As per now, what is happening in the Department of Roads and Infrastructure, they are putting up billboards during the construction of the roads under the ward to ensure that that is transparency, to ensure that how much has been allocated for that, how many kilometers for that, and is it marine, is it grading, is it culvert. So there is more transparency. Also in construction of health facilities, those who have been installed up, because after we are submitting the memorandum and the training and shaping up of the advocacy and skills, now something is changing through the stall project in the level 4 in Kakamega. At least 4 sub-counties, that is in Shinyalu, there's Butere, there's Malava, and there's Lurambi. So it means that something is happening after these trainings, and now we have now the skills that is equipped, we can do now advocacy.
As a county government, because we know how beneficial the community of practice is, we normally do a formal invitation to them just to come and also give us their issues on public participation. I can assure you that we did it in 7 sub-counties, and we had a representation in each of the sub-counties, including where I was surprised in Mateos, they sent more than 5 people to come and just give their views. Again, we have also received a memorandum which we have addressed. They have mentioned issues to do with education, ECD classrooms, before and even the other day. Like last year, they gave us a memorandum to do with ECD. We were able to budget more than 100 ECDs that are being constructed countrywide, almost to a completion. Some are complete. And in this current budget now, at the same point, we have also been able to address most of the issues to do with health. They have been able to mention that. Yeah, the only challenge we have, there are some issues that they might be raised, and again, based on the limited resources, we just give them priorities. But both of them are very key. We have a lot of memorandum from the community of practice.
Because of the push of the civil society organizations, walking around Kakamega, you will find that most of the ECD centers are now conducive for learners. And also the health centers. Health centers are now many. Places that we never thought 20 years, 30 years ago that we would not have a health center, it is there because of the demand of the people and also the push of the civil society organizations within those areas. The civil society has also pushed us to make public participation more efficient and effective, to the extent that they even assisted us in developing a call center. Now in Kakamega, any citizen anywhere, even outside the country, but who has specific issues, will be able to call the toll-free number and have his issues solved there and there. Or if the person receiving the call does not have the sufficient information, it gets escalated to the director in charge, the chief officer in charge, waziri in charge, so that citizens receive solutions to issues that they raise.
So we are doing dialogue we are doing public litigation, we are doing lobbying and advocacy, we are doing local resource mobilization, we are doing mobilization of persons for the space in order to be able to engage. So we are doing more or less a multifaceted approach toward advocacy as compared to what we used to do before. There is less mabango now, and there's less placards, but more discussions. And I can tell you that as the members of the community of practice, now we are at a high level of engagement with the county government. The CSOs are more respected now, they are more listened to, and as a result, the voices of the citizenry is more amplified as compared to what we used to engage in the past.
Maybe we also need to scale up this work to different counties as opposed to working with the 6 counties, because we have had success stories from Busia, we have had success stories from Kakamega. So each and every county also needs to feel part and parcel of the good work that we are doing. So scaling is possible with support from each and every one of our partners. Thank you.